In this podcast episode, Dr. Casey Means, an expert in metabolic health, discusses the importance of metabolic function and dysfunction in overall health. Metabolism is the process of converting food energy into human energy, essential for all bodily functions. However, the modern American lifestyle has led to a rise in metabolic dysfunction, affecting 93% of American adults. This dysfunction is rooted in mitochondrial dysfunction, chronic inflammation, and oxidative stress. Mitochondria are the powerhouses of cells, responsible for converting food into energy. However, various environmental factors, such as processed foods, lack of sleep, sedentary lifestyle, exposure to toxins, and chronic stress, have led to mitochondrial dysfunction. This dysfunction results in underpowered cells, leading to a range of health issues, including obesity, diabetes, fatty liver disease, and autoimmune disorders. Chronic inflammation, a response to cellular stress, further exacerbates metabolic dysfunction. The body's immune system is activated due to mitochondrial dysfunction, releasing extracellular ATP and triggering an inflammatory response. Oxidative stress, caused by dysfunctional mitochondria, leads to the production of damaging free radicals, further contributing to cellular damage. The current healthcare system focuses on treating the symptoms of metabolic dysfunction rather than addressing the root cause. Specialized treatments for individual symptoms often overlook the interconnected nature of metabolic dysfunction. This approach has led to a rise in chronic diseases in the United States, with high rates of obesity, diabetes, cancer, Alzheimer's, and autoimmune disorders. Means emphasizes the urgent need to shift towards a holistic approach to healthcare that focuses on improving metabolic health. By addressing mitochondrial dysfunction, chronic inflammation, and oxidative stress, individuals can improve their overall health and prevent the onset of chronic diseases. Understanding the impact of the environment on metabolic function is crucial in developing effective interventions. Creating capacity in the body to convert potential energy into usable energy is key to improving metabolic health. By optimizing mitochondrial function and increasing energy utilization in cells, individuals can prevent the storage of excess energy as fat. Insulin resistance, a common consequence of mitochondrial dysfunction, can be addressed by enhancing the body's ability to convert substrates into usable energy. Means emphasizes the need to promote mitophagy, the recycling of old mitochondria, promote mitochondrial biogenesis, increase oxidative capacity, and improve mitochondrial fusion. She suggests various lifestyle habits to achieve these goals, such as endurance exercise, high-intensity interval exercise, resistance training, and regular walking. Walking, in particular, is highlighted as a simple yet effective way to improve glucose disposal and mitochondrial function. She mentions studies showing that walking 7,000 steps per day can significantly lower the risk of mortality and improve metabolic health. Means also discusses the benefits of incorporating short walks after meals to reduce blood glucose levels. She recommends incorporating regular movement throughout the day to keep glucose channels active at the cell membrane. Means also touches on the importance of higher intensity exercise, such as high-intensity interval training, for improving mitochondrial fusion. She suggests following the regular exercise guidelines of working major muscle groups 3 times a week and aiming for 75 to 150 minutes of moderate activity per week. The conversation shifts to the use of under-desk treadmills as a way to incorporate more movement into daily activities. Means highlights a study showing that using under-desk treadmills for a few hours a day can lead to fat loss and lean muscle gain. She recommends starting the day on a treadmill desk and incorporating short walks throughout the day to increase overall movement. Means explains that fasting glucose, triglycerides, and hemoglobin A1C can give insights into mitochondrial dysfunction, insulin resistance, and metabolic health. She highlights the importance of understanding these biomarkers and reading the tea leaves to interpret what they reveal about cellular function. By looking at these markers, individuals can assess their metabolic health and make informed decisions about their lifestyle and dietary choices. Means provides insights into the role of food in metabolic health, emphasizing that food is the molecular building blocks of the body. She explains that the body is constantly evolving and changing based on the food we consume, highlighting the importance of giving the body the right nutrients to support cellular function. Means suggests that individuals should focus on real, unprocessed foods from good soil to meet the body's fundamental needs. She discusses the impact of ultra-processed foods on obesity and chronic diseases, noting that these foods lack the necessary molecular information for cellular function, leading to overeating and metabolic dysfunction. She mentions that our current food system is failing, with a large percentage of children being overweight or obese due to the prevalence of ultra-processed foods. Means mentions a study by Kevin Hall where participants consumed ultra-processed food and real food for 2 weeks each. The study found that individuals consumed significantly more calories when eating ultra-processed food, highlighting the importance of choosing nutrient-dense, unprocessed foods for overall health. She discusses the brain's role in regulating hunger and satiety, highlighting the hypothalamic circuitry that drives these processes. Means explains that our bodies are designed to forage for amino acids and micronutrients, which are essential for metabolic processes and tissue repair. She emphasizes the importance of eating foods that provide high-quality protein, fruits, vegetables, and healthy fats to support satiety and overall health. Means introduces the concept of nutrient-sensing cells in the gut, specifically L cells, which produce satiety hormones like GLP-1. She explains that stimulating these cells through fiber, omega-3s, healthy protein, probiotics, and antioxidants can help regulate hunger and reduce cravings. She also discusses the role of short-chain fatty acids, amino acids like valine and glutamine, and compounds like THIDs in stimulating GLP-1 production and promoting satiety. The conversation shifts to the use of GLP-1 analogs like opioid-induced constipation, OIC, as appetite suppressants. Means highlights the high cost of these medications and the push from the pharmaceutical industry to classify obesity as a genetic disease to increase insurance coverage for these drugs. She expresses concerns about the long-term effects of GLP-1 analogs on metabolic health and the potential loss of lean mass associated with their use. Means acknowledges that some individuals may benefit from medications like OIC in conjunction with lifestyle changes, such as improving diet and exercise habits. She suggests that a combination of pharmaceutical interventions and behavioral changes may be necessary for some individuals struggling with weight management. However, she cautions against relying solely on medications without addressing the root causes of metabolic dysfunction. When it comes to temperature, Means explains how humans have evolved to respond to fluctuating temperatures and how deliberate cold exposure can stimulate mitochondria to work harder. She also mentions the benefits of heat exposure in improving metabolic health through the activation of heat shock proteins. She shares her personal experience with cold exposure and how it has positively impacted her health. Moving on to fasting, Means discusses the benefits of compressing eating windows and how this can improve metabolic health by reducing glucose and insulin levels. She explains how skipping breakfast or dinner can be a simple way to incorporate fasting into one's routine. Means also touches on the importance of food timing, mentioning a study that showed lower glucose and insulin responses when eating earlier in the day compared to eating later at night. Means then delves into the topic of continuous glucose monitoring, CGM, and its role in providing insights into blood sugar levels. She explains how adding fat and fiber to meals can help lower glucose responses and improve metabolic health. She shares her own experience with CGM and how it helped her make adjustments to her diet to better manage her blood sugar levels. She also discusses the significance of glycemic variability and area under the curve in assessing metabolic health through CGM data. One of the main factors influencing metabolic health is insulin resistance, which is linked to the body's ability to regulate glucose levels. Means discusses the concept of the dawn effect, where glucose levels rise in the morning due to the release of cortisol to fuel the muscles. She explains that the magnitude of the dawn effect is correlated with insulin resistance, and individuals with higher dawn effect may be under more stress or have higher cortisol levels. Monitoring glucose levels can help identify patterns and early predictors of metabolic dysfunction. Means also highlights the importance of understanding how different foods impact glucose levels. She mentions that certain foods, such as instant oatmeal and sweetened green juices, can cause significant spikes in glucose levels, leading to crashes and cravings for high-energy foods. By using CGM data, individuals can identify which foods are causing spikes in glucose and make informed choices to maintain stable blood sugar levels. In addition to diet, Means discusses the role of lifestyle factors in metabolic health. She emphasizes the importance of getting sufficient sleep, engaging in physical activity, and managing stress to support optimal metabolic function. She explains how stress can impact glucose levels and how spending time in nature can help reduce stress and promote a sense of safety in the body. She encourages individuals to spend more time outdoors, connect with nature, and create a sense of abundance and harmony to support overall health and well-being.